Due to the rising concerns surrounding COVID-19, we'd like to share with the citizens of Springdale what precautions the Springdale Fire Department is taking to protect both the community and our first responders. Our goal is to prepare as much as possible so the public and our department stays healthy and ready to serve you. Responses to 911 emergencies will continue as always. However, you may see some changes in the way we respond to our medical calls. First, our communication center and 911 dispatchers may ask additional screening questions when taking 911 calls that meet specific criteria. The purpose of these questions is to identify an exposure potential, allowing our first responders to take additional measures to effectively provide patient care and to protect both ourselves and the patient. When our responders arrive, you may see a difference in the way they approach someone who is sick. For example, a single responder will make contact with a patient to assess their condition, while the remaining responders stay outside by the street. The outside responders will be protected and limit any chance of exposure. Rest assured, these crew members will be ready to step in and assist if additional help is needed. You may also see a fire engine arrive prior to an ambulance, but they may stay outside in the truck until the ambulance arrives and makes patient contact. You may also notice our responders wearing more medical safety equipment than usual. If you see one of our responders dressed like this, please don't jump to the conclusion that COVID-19 has been identified in your neighborhood. We are just practicing due diligence to limit the potential of a possible exposure. All of our ambulances have been equipped with extra decontamination supplies and equipment. We will be performing a very thorough decontamination of our ambulances after transporting a patient with symptoms that are suspect to COVID-19. One protective measure is an air and moisture barrier between the patient compartment and the cab of the vehicle where the driver sits. The front and back of the ambulances are equipped with independent air controls, so air is not shared through the vents. After each call, we use a combination of disinfecting chemicals and cleaning methods to kill any possible viruses or germs. All of our decontamination products are EPA registered to be effective on infectious pathogens, including COVID-19. By ionizing the cleaners using specialized equipment, it helps the product stick to vertical surfaces and hard-to-reach places. Responders will then decontaminate all clothing and uniforms immediately after transporting to a medical facility. Together, this rigorous process will eliminate the possibility of any cross-contamination between calls and patients. We're going to great lengths to serve our public and protect our community. The Springdale Fire Department will remain vigilant to continue to provide the highest level of emergency services possible to the citizens of our city.